the chaotic rhythm of the heart that causes blood to pool in the heart's upper chambers, which is also known as the atria. This then forms blood clots, which are basically clumps of blood. The blood clots then dislodge from the heart and travel to the brain, which then ultimately causes a stroke.
The consequences of this anatomical changes are dizziness, the inability to exercise, weakness, anxiety, faintness, confusion, and an irregular heartbeat.
You may or may not show symptoms, but if you do, there would be heart palpitations, shortness of breath, and fatigue. Here are two diagrams. One is of a normal ECG and one is the ECG of an atrial fibrillation. With the normal ECG, there's the P wave, the QRS wave, and the T waves. But with atrial fibrillation, since there's the irregular heartbeat, there are no normal P waves, QRS waves, or T waves.
In the second diagram, we see two hearts. The first heart is a normal heart with no afibrillation. As you can see, there is no stress on the heart and the heartbeat is normal. The second heart has stress and is out of rhythm with its heartbeat. Some immediate treatment options are medications, cardioversion, electroshock treatment, and getting fitted for a Watchman. There could also involve a small surgery called ablation.
Right after the immediate treatments, you should eat heart-healthy foods, exercise regularly, not smoking at all, maintaining a healthy weight, and keeping blood pressure and cholesterol levels under control.
Long-term effects for most patients is risks of strokes, heart failure, and chronic fatigue, though over time with medication, AFib will most likely go away.
You may have triggered your AFib by drinking too much alcohol, being overweight, or drinking too much coffee, teas, or energy drinks.
AFib can be serious, especially to those with diabetes, high blood pressure, or other heart disease. If you are diagnosed with AFib, you and your doctor would do more tests to see which of the three types of AFib you have. The three different types of AFibs are paroxysmal, persistent, and long-term persistent. Paroxysmal can be treated very easily with medication. Persistent would use the heart treatment, and long-term persistent would use Watchman and the small surgery.